the cure rate. Premier Li Keqiang has emphasized the combination of traditional Chinese medicine and Western medicine to improve clinical treatment efficacy. Today, we'll focus on TCM efforts in COVID-19 response. We have with us Academician Tong Xiaolin of China Academy of Science and the Chief Researcher of China Research Institute of TCM, Master of Traditional Chinese Medicine, and from BUCM, Mr. Wang Qi, Vice President of BUCM, Professor Wang Wei, Party Secretary of Dongzhimen Hospital, Mr. Ye Yong'an, to take questions on the combination of traditional Chinese medicine and Western medicine, efficacy of TCM, and application of decoctions. Some updates on the pandemic. In the 24 hours of April the 16th, according to reports from provinces, cities, and Xinjiang Production Construction Corp., new confirmed cases 26, including 15 imported cases, 8 in Heilongjiang Province, 3 in Shanxi, in Tianjin, Fujian, Shandong, Guangdong, 1 respectively, 11 or domestic cases, 5 in Guangdong Province, 3 in Heilongjiang Province, 2 in Shandong Province, and 1 in Liaoning Province. There was no new death. New suspected cases 3. All were domestic suspected cases, 2 in Heilongjiang Province and 1 in Inner Mongolia. On the day, newly cured and discharged from hospitals 52. Close contacts that were removed from medical observation 412. Severe cases were reduced by 6. On the front of imported cases, remaining confirmed imported cases 879, including 45 severe cases. Remaining suspected imported cases 57, cumulatively confirmed cases 1,549. Cumulatively cured and discharged from hospitals 670. No death case among imported cases in the morning today. COVID-19 Response Command Center in Wuhan City has reported the verification of confirmed cases and death cases according to the revision and correction made as of 24 o'clock April the 16th, according to reports from provinces, cities, and Xinjiang Production Construction Corp. Remaining confirmed cases 1,081, including 89 severe cases. Cumulatively cured and discharged from hospitals 77,944. Cumulative deaths 3,342. Cumulatively reported confirmed cases 82,367. Remaining suspected cases 62. Cumulatively traced close contacts 722,909. Close contacts that remained under medical observation 8,970. In Hubei province, there was no new confirmed case, no new or existing suspected cases, no new death, newly cured and discharged from hospitals 17. Remaining confirmed cases 129, including 32 severe cases. All were Wuhan cases. Cumulatively cured and discharged from hospitals 64,452, including 47,300 in Wuhan. Cumulative deaths 4,000, plus including 3,869 in Wuhan. Cumulatively confirmed cases 67,803, including 50,008 in Wuhan. According to reports from provinces, cities, and Xinjiang Production Construction Corp., new asymptomatic infections 66, including 3 imported asymptomatic infections on the day 10 were transferred to the group of confirmed cases, including 6 imported asymptomatic infections. On the day, 50 were removed from a medical observation, including 8 imported asymptomatic infections. Those who remain under medical observation as asymptomatic infections, 1,038, including 206 as imported asymptomatic infections. From Hong Kong, Macau, and Taiwan, cumulatively confirmed cases 1,457, including 1,017 in the Hong Kong SAR, 45 in the Macau SAR, and 395 in the Taiwan region. On April the 16th, new domestic confirmed cases are mostly related to the previously announced cluster cases for the past week. New domestic confirmed cases 52. The most since the start of this month. We must keep unrelenting focus on the prevention and slacken no efforts to curb the revival and resurgence of the transmission. Now we'd like to take questions from the floor. Please ask questions on today's topic, and please identify yourself before you ask the questions. Journalist from the first row on the right side, please. Thank you. With the Xinhua News Agency. We know Academician Tong was among the earliest experts who arrived in Wuhan on the eve of the Lunar New Year. In the past 2 months, what were the major jobs taken by you? What has been your pronounced experiences and impression? I'd like to ask Academician Tong to answer the question. Yes, on 24th of January, or the eve of the Lunar New Year, I arrived in Wuhan. That was a cold and wet night. It was drizzling. After supper, we took a walk in the yard where we lived for almost an hour. I felt the climate was cold and wet. Because of the weather, I opened the window, turned off the air conditioner, to feel the environment that the virus was transmitting in. Prior to our arrival in Wuhan, we looked through some of the video literature and we read the case records of patients. So we were thinking, in a context like this, how can TCM help when any emerging infectious disease comes? Sometimes they catch us by surprise and we cannot very quickly invent effective and targeted vaccines or medicines. However, from the lens of TCM, we can provide a basic definition. So that is the environment that the virus has been transmitting under the environment of coldness and dampness. On the second day, we went to Jingyintan Hospital. On the way to the hospital, the driver told me that when I visited a massage store, the therapist told him that there was dampness and coldness on his back, and the therapist used moxibustion, and the therapist found some sweats on the belly of the driver. So again, we felt the coldness and the dampness. On the second day, we went to a fever clinic. We saw the place was very crowded with patients. On a day, on average, there might be 1,000 visitors. So we thought the problem might be with the communities. As a member as the team leader of the TCM group of the National Experts Panel, one of my assignment is to work out a protocol for treatment. I did 3 things in the past 2 months. First, I collaborated with other experts to design and to revise the treatment protocol from the 3rd edition to the 7th, including the protocol for rehabilitation.
The second thing I've done is that under the unique context, together with the Wuchang district government and the related hospitals, as well as the medical experts who are not in Wuhan, we come up with a plan to provide the large-scale TCM preparations, and the third is to promote the integrated treatment of TCM and Western medicine. Such integrated approach turns out to be very effective. Thank you. Thank you. Let's continue. On the left, on the front row, the second gentleman reporter, please. Thank you. With the CNR, my question is for academician Wang Qi. At the moment, the priority is to guard against overseas importation as well as the domestic resurgence. So what's the role of TCM? And also, what are the new findings of TCM in prevention and control? Now let's have academician Wang Qi. For TCM prevention, we can describe it in 2 sentences. The first is to boost the immune system, and the second is to avoid the pandemic. All of our efforts are conducted under these 2 guiding principles. As you know that in Chinese history, we used to have more than 300 plagues or infectious disease outbreaks, and TCM was all engaged. For example, in the Qing dynasty, there were a lot of infectious disease outbreaks. At that time, the total Chinese population was more about 300 million, while the European population at that time was more than 100 million. So TCM has protected the Chinese population for many years. There's a Western scholar who wrote a book about the plague and the Chinese people, and he put it that TCM has helped the Chinese despite the various outbreaks. In terms of the specific measures, we develop a toolkit of pandemic prevention. In the toolkit, you may find the particles. These particles or particle preparations have already been tested by the animal model to prove the efficacy. Furthermore, we also provide the oral medicines as well as the external medicines. For external use, we use the fragrant packet. And in crowded places, people can use such medicines for external use to protect themselves from the potential pandemic. And also we focus on the target population and in particular the high-risk populations. And also we have established the clinical evaluation system to monitor the efficacy of the TCM preparations. In TCM, we emphasize a lot about boosting the immune system and as well as the reduction of the harm done by the pandemic. Also, we have used TCM preparations to drive away the pandemic. So we find some preparations that can help the people guard against the pandemic. We've already identified some effective TCM preparations to boost the immune system. Okay, let's continue. On the left, on the second row, the first gentleman reporter, please. Good afternoon. I'm from the China TCM News. On February the 6th, the State Administration of TCM and NHC jointly promoted or recommended the use of Qingfei Paidu decoction. Could you please tell us the clinical use of this decoction? We will have President Wang Wei to take the question. Thank you. Thank you for your question. Indeed, this decoction is the first preparation recommended by the government. So let me brief you on the origin of this preparation and also its application. To implement the January 25th important guidance given by President Xi Jinping in the executive meeting of the Central Committee of CPC. And in the context to treat the patients as much as possible, then in Shanxi, Hebei, Shanxi, and Heilongjiang provinces, we had an urgent clinical observation. We observed at that time more than 200 patients, and we found that the efficacy was over 90%. Then, on February the 6th, NHC and the State Administration of TCM jointly recommended this decoction. Now, the prescription has already been integrated into the 6th and the 7th version of the treatment and diagnosis guidelines. Now, it is widely used in 28 provinces and municipalities, generating quite good outcome and becoming an important therapy. At the same time, we have continued the clinical monitoring and observation. We have expanded the clinical observation to 166 designated hospitals in over 18 provinces, and we have monitored more than 1,800 cases. 92.28% of them had already been recovered and discharged from hospitals. There were 57 severe cases, which had turned out to be very good, effective. None of them had transferred to the critical case or from the mild case to the severe case. So it's really a gratifying result. From our clinical observation, this preparation has this remarkable highlight. The medical insurance scheme has already disclosed that to treat a severe case, it takes about 150,000 RMB yuan. However, if you use this TCM decoction, you may only need a few hundred of RMB yuan, so it's very cost-effective. Also in Shanxi province, we had some initial observation as this was the first province to have such a TCM application, and 103 cases have adopted the preparation with very good symptom improvement. For instance, for the symptom of fever, within 3 days of application, the symptom disappeared, and also the damage to the lung can also be improved greatly.
In Shanxi, we did some initial observation on some suspected cases, and only 10 out of the 187 were confirmed cases. Over 90% were removed from the group under medical observation. So this data has also reminded us that the intervention of Qingfei-Paidu decoction or the lung cleansing and the detoxifying decoction has been proven effective in reducing the likelihood of transferring to confirmed cases. In Hubei province, many manufacturers have prepared and made such decoctions. Since 25th of February, altogether 390 units of the decoction have been distributed, and the particles of lung cleansing and detoxifying have also been distributed on a large scale. We didn't make a systematic observation on larger cohort, but we did some initial and fundamental baseline studies. Up till now, 300 plus components have been verified. We use the pharmacology study, and we believe it may have 790 targets of treatment. Therefore, the decoction can work on different targets for prohibiting the endotoxin development and delay the occurrence of cytokine storm. According to our clinical observation and initial fundamental studies, we believe these can apply across the different types, mild, moderate, and severe. It has been proven effective. So we believe lung cleansing and detoxifying decoction has been proven effective. We also welcome researchers home and abroad to make a comparative study with the use of the decoction in comparison with other medicines. Next question, please. Thank you. With China.org, I have a question for Party Secretary Ye Yong'an from Dongzhimen Hospital. Now, only severe and critical patients are still staying in hospitals. What has been the role of TCM in the treatment of severe and critical patients? Thank you for your question. That's a great question. I want to attempt an answer with one sentence. The combination of TCM and Western medicine has a big room to play its role. During the COVID-19 response in Wuhan, we paid special attention to TCM's role. Experts have been organized to design and improve the treatment protocols by using TCM. 3 medicines and several decoctions have been recommended, and they have played an important role in delaying the disease progress, reducing the transformation from mild to severe cases, and thereby increasing cure rate and decreasing the fatality. As far as what we learned from the experiences of the Hubei hospitals, the fatigueness, the reduce of sets, fatigueness and the shortness of breath can be found among many patients by using TCM. The symptoms have been alleviated. For example, fever, coughs, and fatigueness have seen 90% of decrease. The combined therapy can effectively curb the transmission from mild to severe cases. Among the 80 plus severe cases that we dealt with, 92.5% has shown effectiveness. For the critical patients who have received the combination of therapy with TCM and Western medicine, lung functions have seen improvement, shocks have been corrected, the infectious status can be tangibly improved for some patients with mechanical ventilation or incubation. They have created environment and conditions for them to remove the mechanical ventilation. 2 of the critical patients, after receiving TCM treatment, very quickly remove the tubes. One was on the 3rd day and the other was on the 7th day to have their mechanical ventilation removed. And 3 shock patients, after the administration of TCM, their infection was effectively controlled. The blood pressure was kept stable as well. Another case involved a 79-year-old patient with underlying disease like hypertension, and he met the needs of mechanical ventilation, but with the provision of a TCM, the patient didn't have to go through the mechanical ventilation. All these cases have shown that the introduction of a TCM can help critically ill patients. Thank you. Next question, journalist from the 3rd row on the right side, please. With the CCTV, we know Western medicine and TCM see the same disease through different lenses. I'd like to ask from which lens does TCM view this pandemic? I'd like to ask academician Tong Xiaoling to take the question. Thank you for your question. Yes, indeed, TCM and Western medicine think differently on the same disease. Western medicine regards the pandemic treatment based on legacy treatment with innovation. For TCM, this disease is different from coldness or dampness. It is also different from plague mentioned in the Ming Dynasty's literature. It is different from the flaring heat mentioned in the classical literature. It has its own features. It was similar like what happened 1,000 years ago in a district named Huangzhou, which is the current Huanggang. 1,000 years ago, there was the plague of coldness and dampness, which is similar to today's pandemic, but again, they are different. So our understanding cannot be separated from the Wuhan local environment of coldness and dampness. After the pandemic reached across the country, we have enriched our understanding of the pandemic as we were to design and improve the 3rd to the 7th edition of a treatment protocol. In this process, we've been learning the experiences and practices from across the country. The 3 medicines and 3 decoctions were later added to the protocol as well. We come to the consensus that it is a kind of a plague with the major invasion into the lungs and the spleen. So the foci are in lungs and the spleen with the symptoms of cough, sputum production, and shortness of breaths, fatigueness, and poor appetite, and the diarrhea are because of the invasion into the spleens. If we look at the disease progression, there were the early, middle, and the later all rehabilitation stages. In the early stage, there was the stagnation, and in the later stage, the coughing will be more pronounced, and then there might be the collapse towards the late stage. So localities have accumulated different experiences of treatment, in particular the TCM medicines. But we should tailor-make our approach. The international medical community are also asking us which medicine and decoction should be used, but we believe it should be context-specific.
Let's continue on the left, on the third row, the third lady reporter, please. Thank you. With the CGTN. My question is, in treating the viral infectious diseases, what are the advantages of TCM? For the next step, to deal with the emergencies, how can TCM carry on the sound tradition and make innovations? We will have Professor or Academician Wang Qi to take your question. For TCM's advantages, TCM prioritizes the viral shedding. In the traditional prescriptions of TCM, it emphasizes a lot about the viral shedding and getting rid of the virus. So among the classic prescriptions, there's one medicine or one herbal medicine called Huangqi. This is commonly used in many prescriptions, and it has been found that this particular medicine can help the human body to get rid of the virus. In TCM, we emphasize a lot about the climate and the environment. Now, throughout the world, people are very concerned and interested in the relationship or the connection between the climate and human health. Also, as Professor Wang Wei has mentioned, that there are some prescriptions which are universal, but we also pay attention to the specific features of individual people. So we emphasize the individuality of the TCM prescriptions. So TCM places emphasis on the correlation between the climate and the human body or human health, and also the viral shedding in the overall context. Over the past years, TCM has contributed to the disease outbreaks. For instance, in the SARS treatment. In terms of the innovation, we are going to focus on 3 developments. The first is the human resource development. We are cultivating the TCM expertise. So we have the Peking University of TCM to train the TCM professionals and experts. And the second, following the sound TCM tradition, we are developing the TCM practices. And the third development is the development of the TCM basis. We wish to set up a long-term mechanism applying TCM to respond to the public health emergencies like the infectious diseases, so as to promote the high quality or the quality growth of the medical sector in China. Okay, let's continue. On the right, on the 5th row, the first lady reporter, please. Thank you. With National Business Daily, TCM has provided the 3 prescriptions and the 3 preparations. Apart from these medicinal approaches, are there any other approaches of TCM? Thank you. We will have Academician Tong Xiaoling to take your question. Thank you. Yes, indeed. In TCM, apart from the medicinal approach, we also have non-medicinal approaches, which are also adapted in the pandemic response. For example, the acupuncture, moxibustion, and also the various non-medicinal methods in TCM. In terms of the treatment, these approaches can help relieve the symptoms. Also, they can improve the lesions caused by the disease. We have surveyed more than 600 cases who have applied the TCM, and we found that some of them developed the symptoms like coughing, poor appetite, sweating, and etc. For these symptoms, with the non-medicinal methods of TCM, there can be quite good outcomes. For example, that's why in Leishanshan Hospital and the Wuhan TCM and the Western Medicine Integrated Hospital, as well as the medical teams who were dispatched to Wuhan to offer assistance, and also in the makeshift hospitals, especially for the mild and even severe cases, these non-medicinal methods of TCM are applied. Even in the convalescent period or in the rehabilitation period, the non-medicinal TCM method, like the moxibustion, were applied with a very good outcome. We've just started the research projects for the convalescent period, and we are accumulating the results, but the initial results found that TCM can contribute greatly to the treatment of the cases. Okay, let's continue. On the right, on the third row, the third reporter, please. Thank you. With the cover. My question is, during the pandemic response, what are the R&D experience of TCM can be promoted in the future and also can be intensified in the future? We will have Professor Wang Wei to take the question. Thank you for your questions. I think there are three things that can be promoted and two directions for future efforts. In terms of the experience, I think first, the strong organizational support is of critical importance to promote R&D in the infectious disease response. As you can see, this pandemic response has highlighted the integration of TCM and Western medicines. In the Chinese Academy of Engineering, there is a dedicated working group established for TCM R&D, and supported by academicians like Tong Xiaoling. The working group has dedicated itself to the TCM application. This has also demonstrated the strength of our joint coordination. And the second experience is that faced with this sudden outbreak, the clinical treatment is critical, and it is of paramount importance to integrate clinical treatment with the R&D. So we have clinicians who are treating the patients while collecting the clinical data and sharing these data with the researchers in the back office. Another experience is the close coordination and the support between the frontline and the back office. I think such close coordination is extremely necessary and important. The sound coordination between the frontline and the back office plays a vital role in the pandemic response and also the infectious disease treatment. I think this is also a very useful experience. Also, with the scientific research and development, we can find two directions for future development.
First, as Academician Wang Qi has mentioned, the antiviral research. Over the years, that has been one of the weaknesses of our research. We didn't invest enough in its antiviral functions. And this time, TCM has demonstrated irreplaceable role in the treatment of infections. In face of an unknown disease, TCM has shown its unique advantage. Based on the clinical physics, the onset of time, the region, and also the season, to have a comprehensive analysis and the dialectic treatment. Very quickly, it can work out a decoction or a formulation for treatment. And Western medicine has to go through a rather slow process of animal tests, clinical tests. But the TCM can look at the situation and act promptly. Therefore, we believe if we can enhance the antiviral side of the TCM, it can improve our treatment ability with TCM. Second, in China's history, as Academician Wang Qi has mentioned, we had 352 plagues in our history, which can be found in many of the classical TCM literatures. And most of the formulas of treatment and decoctions have been worked out after the occurrence of major plagues. Therefore, if we dig further into the classical literature, we may find many of the traditional classic which can prove to be of a great value for future responses. Besides, the creation of the lung cleansing and detoxifying decoction is based on Master Ge's experiences in treatment of cold and dampness, and it is based on his observation of the Wuhan cases. 4 formulas from the coldness and dampness treatment classics were summarized into one. From the very beginning, we had an attitude of make some tries, but later it has been proven very effective try. Classical traditional prescriptions can be used for the treatment of new diseases because the roots might be the same. Therefore, the dialectic treatment of TCM might be its unique and lasting feature, which is very different from the Western medicine. There are still big room for further research into the dialectic treatment capacity. Therefore, in the future, national-funded key projects, the science basis of such effective treatment are worthy of further research. Thank you. Thank you. Next question, please. Journalist from the 5th row on the right side, please. Thank you, Mr. Moderator from Dragon Television. My question goes to Mr. Ye Yong'an, who has come back from Wuhan. What are the most pronounced impressions that have left you with during your Wuhan stay? Well, one thing struck me most. That was the affection of the patient. It was like this. When we were delivering services and treatment in ICUs, I met this 70-year-old granny. She suffered from insomnia, and she was crying all day long. And we found the disease was hanging there. There wasn't progress. And many of our colleagues asked her why was she crying all day long. Because the sickness didn't bother her that much. And she told us that her husband was living in the surgery department waiting for the surgery, but her husband was transferred to ICU and was going through mechanical ventilation during the process of awaiting surgery. And then we asked the ICU department, and just by that time we were invited to have the ward rounds in ICU. Coincidentally, her husband received a TCM treatment, and after the combination of TCM, his disease progression was smooth, the outcome was good, the mechanical ventilation was removed, and ordinary oxygenation support was provided, and several days later he was transferred to ordinary ward. And then we consulted the physician in charge whether he can be transferred to the same ward, and then we were nodded with a yes, and we transferred her husband to her ward. And later, when we visited her during our ward rounds, the old granny was gratifying. She was happy. She was peaceful. We saw smiles back on her face. Her disease progression was smooth, and the outcome was good. When our team was about to leave, the old granny remembered each and every of our names. And she said she will always remember each and every of us. She actually remembered each and every of us as a 70-year-old granny. I was impressed. Thank you. Next question, please. Journalist from the fourth row on the right side. Thank you. With the People's Daily, during the COVID-19 response, there has been great achievements in TCM research. Down the road, what will be the focus of TCM research? I'd like to ask Academician Wang Qi to take the question. Science and research efforts along the TCM line have been decided by the State Council Joint Prevention Control Mechanism, and there was the setting up of a special team working on TCM, in which there were 4 sub-committees in parallel: clinical treatment, mechanism study, formulation selection, and system study. So just by looking at the name, you may know what we want to do. First, we will focus on the clinical literature study, and we will make some exploration into the treatment patterns. Second, we will combine the use of TCM and Western medicine with accumulated experiences in this round of treatment. We will focus on the treatment and the support provided to the rehabilitation stage. So this is the first focus. Second focus of our research is that we will study the mechanism behind the effective formulas. We know these formulas and prescriptions have been proven effective, but why was that? We will look behind into the mechanism of treatment. And third, we will promote the clinical study on the formulation review and approval, so that more formulation will be fixed. And fourth, we will conduct the selection among different formulations, since we may have different combinations. And the final focus of us is to promote the integration of TCM into national infectious disease prevention and control system, to establish a sound frontline information platform so that so these have been the focus of our future science and research, and TCM will become a unique component with Chinese feature. Two last questions.
The fourth row on the left and the third lady reporter, please. Thank you. With China Youth Daily, the 4 earlies are important methods against the pandemic. We also find some reports about the TCM's application. What are the roles played by TCM in the pandemic response? We will have academician Tong to answer the question. Thank you for your question. After the community spread of the outbreak, the central guiding team decisively included the 4 earlies into the treatment and diagnosis guideline. The fever, the suspected, and the mild symptom cases, as well as the close contacts, are quarantined and treated respectively in Wuchang district with 1.25 million population and 144 communities. Overnight, this district, with its fairly developed transportation system, became the top district in terms of the epidemic. So we launched the Wuchang model, in which we provide the TCM preparations to the patients immediately. As the cases were quarantined and isolated, so for those feverish patients and the suspected cases as well as the confirmed cases, we use the general prescription, which we call the #1 TCM prescription. And we provided the prescription or the preparation to the target cases in a large scale. And then with the support of the communities and the internet, we developed the Wuchang model. In the model, by scanning the QR code, then the patient's information can be transferred to the back office. In the back office, more than 600 TCM practitioners are providing consultation to the patients, specifically informing the patients the potential side effects that may come along with the use of the TCM preparation, just as Professor Wang Wei has mentioned. In the whole district, as well as the Hongshan and Honghu districts, and also in the neighboring cities, we covered more than 50,000 feverish cases and confirmed mild cases, and also together with the #2 prescription against the pandemic, we increased the coverage. And it is fair to say that the TCM preparations have curbed the potential spread of the pandemic, as well as the potential worsening of the symptoms. The TCM preparations in the Wuchang model have helped to respond to the pandemic and turned out to be a very good model. Okay, let's continue. On the left, on the fourth row. Thank you. With China Daily, we know that in the pandemic response, TCM is engaged, and how about the acceptance or recognition from the patients? We will have Dr. Ye Yong'an to take the question. Well, there were some patients who at the start didn't like the TCM preparations, and also we find some severe cases, and that's why some people choose to take the TCM preparation while the others refuse to take the TCM preparation. We didn't force everybody to take the TCM preparation. But later, with the good outcomes demonstrated by the TCM preparation, those who previously refused to take the TCM preparation came to us asking for the TCM preparation. They said that they would like to give it a try. But very quickly, after 2 times of the TCM preparations, the symptoms were relieved and the good outcome was demonstrated. So the patients got very excited, and they now take the initiative and come to us to ask for the TCM preparation. Soon before we leave the Wuhan, we were approached by the patients asking us what to do after we leave the city, and we helped the patients to continue the TCM preparation. So this is a process from rejection to acceptance. Okay, thank you. On today's press conference, the invited speakers informed us the important roles played by TCM. Some of them were in Wuhan, the Frontline, and conducted clinical treatment, while the others were in Beijing, but organizing the TCM R&D or the TCM development. They have all made great contribution. Thank you so much. For tomorrow's press conference, we will talk about how to improve the international transportation capacity and what have been done in this regard. So we will invite government officials from the related agencies to take the questions from the press. That's all for today's press conference. Thank you.